Hello everyone, welcome to the part 3 video of hyperparathyroidism. Here we see the morphology of the parathyroid carcinoma, and also we see if hyperparathyroidism is remained untreated, then what uh, skeletal changes as well as urinary changes we can see in the patient. First, we begin with the morphology of the parathyroid carcinoma. Its gross feature can be seen as there is circumscribed invasive lesions and that affect mainly only one parathyroid gland out of the four, and that is well encapsulated by the dense fibrous capsule with gray white irregular consistency that exceed the 10 gram in weight, and tumor cells are uniform and resemble normal parathyroid cells, but they are arranged in nodular or trabecular like patterns. However, the diagnostic feature can be like the invasion of the surrounding tissues in metastasis, and that may be localized or that may disseminate to distant site. That means only one third of cases present with the localized masses, while another third present with a distant dissemination. So from this we can appreciate that this parathyroid carcinoma can be localized or can be metastatic as well. And immunohistochemistry shows there is loss of parafibromine expression, and that is present in adenoma but absent in parathyroid carcinomas. Similarly, there is expression of parathyroid hormone GAT3 and a high Ki67 index greater than 5%. All these things also support this diagnosis of the parathyroid carcinomas. And next, we see if this hyperparathyroidism is remained untreated for prolonged time, then what effect it may lead to our skeleton system. First, we see there is OVO, that is osteoporosis, brown tumors, and osteitis fibrosis cystica. Osteoporosis is due to there is a increased osteoclastic activity in the cortical region as well as medullary regions. And in case of cortical region, especially that will affect the subperiosteal and periosteal surfaces, and that results in decreased bone mass mostly in the phalanges, vertebrae, and proximal femur. So this osteoclast, when it remains for prolonged duration, then that results in formation of the tunnel-like structure along the length of the trabecule centrally, and that creates the railroad-like appearance, and that is called the dissecting osteitis. And narrow space replaced by fibrovascular tissues, and you can see in the figure there is a subperiosteal bone resorption, and that is the figure of the phalanges. Next, we can appreciate the brown tumors, and there is a increased osteoclastic activity in the bone, so that predisposes bone to the microfractures, and that results in uh, hemorrhage, which is called as a secondary hemorrhage, and that elicit the influx of the macrophages and the growth of reparative fibrous tissues. And since there is influx of macrophages and other inflammatory mediators, that results in uh, increased vascularity as well as there is a hemorrhage. So all these lead to the hemosiderin deposition at the site of injury or at the site of the microfractures, and that give the brown appearance to the mass. Since there will be the mass formation at the that site, at the site of the microfractures, that results in formation of those reactive mass, and that is called as a brown tumor. Sorry, there is rumor, but it's tumor. And hallmark of the severe hyperparathyroidism occur in combination of the increased osteoclastic activity, peritubular fibrosis, cystic brown tumors, and that all called as generalized osteitis fibrosis cystica, and that is also called as bone wrinkling Hausen disease of the bone. Here in the figure, you can see in the metacarpal bones there is a brown like appearance, black appearance demarcated by this. That is shown by the white arrows, and that is a brown tumor. And urinary changes that can be seen in the parathyroid induce hypercalcification, the formation of urinary tract stones, that is nephrolithiasis, then the renal interstitium and tubules, and similarly also the calcification of the renal interstitium and the tubules and calcinosis. And there is a metastatic calcification secondary to the hypercalcemia in the other sites such as stomach, lungs, myocardium, and blood vessels. Such things can also be appreciated in these cases. Thank you for having your patience.